So this is my presentation to walk you guys through the current COVID-19 response in Yuba and Sutter counties for the past couple of months, okay? So we all know that the coronavirus, SARS-CoV-2, leading to the disease known as COVID-19, began in late 2019 in Wuhan, China. And late February, we stood up separate Department Operations Center at a readiness level. And then on March 10th, 2020, I declared a state of health emergency locally. And then we established a joint DOC for both counties. And then on March 13th, the president declared a state of emergency for the nation in regards to COVID-19. On March 18th, I issued a directive for stay at home, and then one day later, Dr. Sonia Angel, as the state public health officer, issued a statewide shelter-in-place order. Our first cases way back when was March 23rd for Yuba and Sutter, and then on April 6th, I converted my stay-at-home directive to a stay-at-home order, and it's still in effect, and it expires at 11:59 p.m. on May 3rd, this Sunday. So I'm going to walk you guys through just the top highlights of what is in my current April 6th to May 3rd stay-at-home order. It closely resembles the state stay-at-home order. There's still that binary dichotomy between essential and non-essential businesses. Essential employees should work from home to the greatest extent possible. Residents are instructed to leave their homes only necessary for essential functions. No social gatherings, non-essential travel not allowed. So this is what's going on. So as you see, that's a little bit dated because we put together this presentation several days ago. But as of April 26, we had total cases of 45, 3 deaths, 7 hospitalized in total, not currently hospitalized, but in total. And we tested nearly a little more than 1,400 tests. Usually for each confirmed positive case, there is about 10 close contacts. So that's why you see that 450 number. So it's a long process, and it's a pretty challenging process for the Department Operations Center staff to follow up on all of these close contacts. We also worked very closely with first responder in regards to suspected cases and confirmed cases. And the call center have taken nearly 3,500 calls since we stood the call center up a couple months ago. So this is what we call the epidemic curve slide. So you've seen it on the dashboard, you've seen it likely for other counties, but I want to really highlight one thing is that this epidemic curve is showing when the case is reported symptom onset. So whenever a positive case is reported to us, I ask the staff to go back, and when they call the patient, to ask them, when did your symptoms start? So that really removes sort of the false artifice of reporting by, say, the date of when they went to get testing, and especially the date when the test result comes back, because as you guys know, we were really struggling with that in the state or even in the country with the turnaround time for a majority of these tests, like 5 days, 10 days. But as you can tell, the epi curve is plateauing, and it has really plateaued since early April. So that's for Yuba and Sutter. If you look at the region, so say for the Sierra Sacramento Valley area, and especially for our southern neighbors of Placer County, Sacramento County, and Yolo County, they have also plateaued. They were just a couple weeks behind us. So for the past week and a half, almost 2 weeks, those three southern most populous counties in our region have also plateaued in regards to their cases, meaning the rate of new cases being reported has been plateauing. So when we look at a reopening plan it should be phased, it should be gradual. So on April 16th, as you guys know, President Trump outlined a plan for opening up America again, 3 progressive stages, and it would really be guided by whether you have at least a 14-day decline in the rates of cases and the case counts, new case counts reported, and then to ensure that the hospitalization is decreasing. So fortunately for Yuba-Sutter, all those metrics are met. Currently, right now, we only have 1 hospitalized patient. It's actually not in our counties. That patient's hospitalized in Sacramento County. And then on April 14th, as you all know, Governor Newsom identified 6 indicators for modifying the stay-at-home order. With the start of OptumServe testing site on May 4th, we are very excited, and we feel that with them, we will have the capability to expand testing to mildly symptomatic and even high-risk asymptomatic individuals in our region very soon here. And then we do have a robust contact tracing that is from my colleagues at the Department Operations Center, Operations Section especially, and we do a great job of being able to identify and contact each positive case and making contact also with their close contacts. We do have ability to identify infection in at-risk population, and as of right now, given the past 2 months of really robust planning, Adventist Rideout and other health partners, Southern North, AMPLA, Peachtree, Harmony Health, they're in a really good place to handle any possible surges, including with that, of course, as you all know, about the ACS planning that we have been doing just to complement what the healthcare facilities have been doing. Developing therapeutics, no one's going to successfully have that until late this year or early 2021, because that really means, do we have a vaccine? Do we have a medication that really is proven through randomized control trial? There are some early signs of one medicine called remdesivir that might be helpful, but overall, we're at least several months away, if not even a year away from that occurring. So now I'm going to talk about my plan for the Yuba-Sutter modified order that I want to take effect as of 12:01 a.m. on May 4th. But before I talk about the new order, I want to make a strong reminder that every resident in Yuba-Sutter are residents of the state of California and therefore are still subject to the laws and rules and regulations of the state of California, including the orders of the governor and the orders of the state public health officer, and the state stay-at-home order is still in effect. So when I was thinking about my stay-at-home order, the current one that's going to set to expire 11:59 p.m., I said, what should I do next? And I was really concerned that if I allow my current order just to expire and then have the region be under only the state stay-at-home order, I felt that many in the community will see that as a strong refutation of the state order, and also then to assume that they should go from 0 up to 100% and back, quote unquote, to normal fully. I think that's very dangerous and will likely lead to outbreaks and hospitalization that will overwhelm our healthcare system. So that option I felt was not prudent. The second option I thought about was, should I just extend my current order and extend it out 2-3 weeks to say 3rd week of May? But then I reread my current order, and given the current data that we see in Yuba-Sutter in the past several weeks, like I presented in the epi curve, given what's also going on in our region, I didn't think that the current order still applies. So we always have to have this delicate balance between having restrictions on individuals' movement because of public health emergency, but when the data is showing that we're showing some optimistic improvement, then we need to reweigh that and recalculate that to always maintain that delicate balance. So that second option I also removed. And then I went about thinking about crafting a new order. and that is the one that I'm going to be talking to you all about now. And I really struggled when I was looking at drafting the new order about the essential versus non-essential. I think that's now a false sort of dichotomy, a false delineation. Don't get me wrong, when we first started on March 18th, March 19th, we had to act quickly, we had to act broadly. Obviously, we couldn't stop everything. You still needed public safety, you still needed food, you still needed urgent health care. So that's why the delineation between essential and non-essential was appropriate for that time. But as we move along now and we're looking at reopening, why maintain that false dichotomy? Why is a store that sells groceries and flowers allowed to remain open versus a store that only sells flowers? Arguably, the risk might be lower in the flower shop only versus the big store that sells groceries and flowers and everything else. And I really want to keep in mind the totality of health. So COVID-19 is dangerous, is scary, is still going to be the primacy of concern for a long time, but it's not all the factors of health. We need to make sure that we consider that the economics that impinges on health. If you don't have a job, then you will have to make the hard decision of paying for food, paying your rent, or paying for your insulin if you are diabetic. Those are really hard decisions, and if you decide not to pay for your insulin, you're gonna have strong consequences from poorly controlled blood sugar. And it really must be grounded in science. And what is the science of COVID-19 and how we know that it's transmitted and how we know that it's infected and brought in to really guide the modified order. So to that effect, the intent and purpose of the new order, I really emphasize personal responsibility. So everyone knows by now that social distancing of 6 feet or more is very important, because then you don't share the same quote-unquote airspace as someone else, and decrease in the risk of transmission if someone is asymptomatic and infectious, especially good hand hygiene, frequent hand washing or use of hand sanitizer, staying home if you're ill with cough, fever, shortness of breath, and facial covering when you cannot maintain social distancing possibly. And really, it comes down to the fact that those common sense movements, go out when you need to, for work, for sustenance, for recreation, to really maintain physical, mental, and economic health. So contact investigation will continue and be aggressive. We've actually elevated and increased our number of contact tracer many folds in the past several days, with the expected increase in case count with OptumServe coming on Monday. But really, the benchmark should be hospitalized cases, because that's going to really tell me and tell the public health team, are we overwhelming? Are we overtaxing the healthcare system? And if hospitalized cases remain low as it has been, then I can be more assured that we are not doing that. So that is the main and the crux of how I want to approach this new order. So totality of health, we just mentioned this, and to also then really focus on a holistic approach, grounded in science, evidence-based, but realize again that COVID-19, however scary, however dangerous for our region, our state, our country, the world, should not only be the main health concern. There are many, many other health concerns and factors, including economic factors, that impinges on those health concerns. So I went through and looked at available guidances nationally, and I came across the Johns Hopkins Center for Health Security, and they have a great document they pushed out. It's public health principles guidance for reopening, and in it they really focus on a risk stratified approach. So what does that mean? They risk stratify businesses and organizations into low, medium, and high risk based on two things: contact intensity and number of contact. Contact intensity really means how long are you next to someone in close proximity, less than 6 feet away. So say if you need to get a haircut, you are there for close, less than 6 feet away from someone for 30 minutes versus if you are just buying a sweater and you're really only interacting with someone for 5-10 minutes and making that transaction. The number of contacts really come into place if there's a difference between a small cafe where there's maybe 10 people in there versus a concert hall where there is 100 people. So in the case, and there will be in the case where there are a positive person among those 10 in that cafe, my staff, DOC staff, will only have to follow up on 9 others. Whereas in that concert hall of 100 people, that's 99 people that we have to follow up on. And what would be the risk of potentially not being able to contact all 99, and then those ones that we miss, they don't know that they were in close contact and they would inadvertently continue to pass on the infection. And that's what we don't want. We want to quickly identify positive cases, identify their close contacts, advise them to undergo home isolation, home quarantine, so that we can break the chain of transmission as quickly as possible. And really that's the crux of what is done in regards to contact tracing. So with that said, with my new modified order, I am allowing in the local public health officer order for Yuba County and Sutter County, businesses that have low to medium contact intensity and low to medium in regards to number of contacts to open with appropriate modifications. And these lower risk businesses, as you can see some here, there's an asterisk on hair salons and nail salons and other personal care section because in the Johns Hopkins document, it's medium/high risk, and it's really about duration of interaction in close proximity. So my order specifically state that it should be 30 minutes or less in regards to that close contact to really minimize and decrease the contact intensity from high to a solid medium. So what are in the modifications? You guys all know because you are the compliance task force that actually worked on that COVID-19 business protocol, and we utilize that as the guidance, and every lower risk businesses listed within the order must have a robust COVID-19 protocol to address modification to ensure that they have mitigated the risk of COVID-19 for their staff, their clients, etc. They're going to be required to provide that to their employees, and also if they serve the public to post the protocol in a public entrance. So this is a phase opening. This is the initial phase, and in the initial phase there are going to be businesses and organizations that by their inherent operation and services have to be considered higher risk regardless of modification. So for any organization or business that is high in regards to contact intensity and or high in number of contacts, these businesses shall remain closed. Okay. We have to make a delineation somewhere, and the phase approach is to ensure again that we don't inadvertently lead to a resurgence of cases, and especially overwhelming our hospital, our healthcare system through severe cases needing hospitalization and ICU care. So some examples we've listed here: the floors, low traffic, short duration of interaction, low risk interaction, restaurants, even in dining in when with appropriate non-pharmacologic interventions such as social distancing, dining in only with household members per table, frequent disinfecting of surfaces, use of facial covering by staff would present a medium risk interaction. Small gatherings, these are social gatherings, so this would be, say, a small birthday party or a small dinner party. Gatherings of 10 or less proves a medium risk, but even in these small social gatherings, social distancing should be adhered to, and if not possible, then facial covering should be worn. Large indoor and outdoor gatherings are high-risk interaction, just again because of the fact that the sheer number of people is too high, and we're always very concerned that if there is a localized outbreak, more than 10, we will potentially miss and not be able to find all those contacts, and then therefore we won't be affected in breaking the chain of transmission. So thank you all on my behalf and everyone in the Bi-County team. Without your guidance, without your input, especially in regards to the COVID-19 protocol, and also I will need your help as ambassadors to inform the community about this new order, and also to ensure that they comply, and it's going to be a community-wide effort. So implementation, businesses in Yuba and Sutter counties deemed to be lower risk, as we've just talked, would be instructed to comply with the new order. We have been working very diligently, you all, PIOs, everyone, in regards to putting together support materials, like a toolkit per se, talking and even posters about social distancing, facial covering, how to appropriately disinfect high-use surfaces, limiting of contact duration in close proximity. And we talked about the operation protocol already being posted publicly and provided to employees. I want to reiterate one very important thing. The state stay-at-home order is still in effect. If there is a difference between the state stay-at-home order and my May 4th new order, then businesses need to seek private legal counsel to determine the appropriate course for their specific business. The county board supervisor, myself, we cannot provide that legal advice to those businesses nor to the public. Okay, so this is some of the toolkits, etc. And I know that Kevin Mallon and his team and law enforcement, environmental health, the PIOs, they have been working so hard to make sure that after the rollout of the order, that they will go and check on these businesses and make sure that if there's any gaps in terms of knowledge gaps in terms of the protocol implementation, that they can fill in those knowledge gaps. We also will stress that the public should not be calling through dispatch to 911 about concerns, but there's a protocol for them to contact us in the county to relay any concerns or any reports. So I believe that is it for me. I will stop sharing now.